Struggling with a swollen knee and unsure how to handle it? You are not alone. Did you know that 1 in 4 adults over 55 experience knee swelling, even without an injury? Whether it's from an injury or other causes, knee pain and swelling can seriously impact your life. In this video, we'll dive into what you can do to manage it and stay active. As an osteopathic practitioner and an athletic therapist, I have worked with countless clients dealing with knee pain and swelling, all searching for effective solutions. That's why I've put together these 3 exercises to help you reduce your inflammation in your knee and get moving again. Make sure you stick around until the end, where I'll reveal common mistakes to avoid that could be making your knee pain worse. So what causes a swollen knee? Let's begin with a little bit of the education on why this happens. So there are 2 most common causes. The first is an acute injury, so such as a sprain, strain, contusion, or a fall. So sprains being like your MCL, your LCL, ACL, or PCL. Often with the MCL and LCL, you'll see swelling more locally around the inside or the outside of the knee. And for the ACL and the PCL, the swelling usually starts a little bit slower, and you'll usually see it right surrounding the whole joint. The whole knee will look quite swollen. And if there's a significant amount of swelling in the knee joint, what you can develop is a Baker cyst, which is essentially the swelling in the knee joint has to go somewhere. It gets pushed out the back of the knee and creates a small little lump on the back of the leg, which is essentially a Baker cyst. So if you feel pain at the back of the knee, that could be why. And the second cause is chronic injury, such as knee osteoarthritis, also known as degenerative joint disease. This is typically the result of wear and tear and progressive loss of cartilage in the knee joint. And there's also gradual changes as we get older, stresses of daily life, our activities, and lifestyle. Common clinical symptoms include knee pain that is gradual in onset and worse with activities, knee stiffness and swelling, pain after prolonged sitting or resting, and pain that worsens over time. This swelling can significantly impair daily activity like climbing stairs, walking, or standing for extended periods of time. So let's jump into the rehab exercises. So the first exercise we're going to do, you are going to need an exercise ball or socks. We are going to do wall slides. So this is a great way to reduce inflammation in your knee, improve range of motion, and you can easily do this at home. So lying on your back, you're going to place the ball up against the wall, your foot in the middle of the ball, and you're slowly going to extend your leg up towards the ceiling. Try to get the quad firing a little bit there, and slowly bringing your heel back down. This one you can come as far as you feel comfortable and extend all the way up as far as you feel comfortable. So you don't want to push into that pain range. If you find that the end ranges are a little bit too sore to do, you can just start nice and easy. So I love this one because, again, gravity is assisting that inflammation to get it out of the knee and bring it towards your pelvis. Nice gentle exercise. You can start with 2 to 3 sets of 10 to 15 repetitions. Now, as I mentioned, if you don't have a ball, that's totally fine. You can put a pair of socks on, or you can use a small towel up against the wall to assist you for sliding. You're going to lie on your back, this time a little bit closer towards the wall. Have both feet up against the wall. Extend one leg up, slowly slide it down, bringing it as far down as you feel comfortable. Let's say that's your end range there, perfect. Then slowly going back up to extension. So again, love this one because gravity is assisting you, assisting that inflammation. It's also just a great way to, if you don't even want to do the mobility exercise and it's too much maybe, and you just had this injury occur, you could just have the legs elevated and resting. So this one, I suggest you at least do this once for 2 to 5 minutes, and you can repeat this multiple times per day for assistance. Now, the second exercise you're going to do is a dynamic hamstring stretch. So you don't need any equipment for this. We're going to do 2 to 3 sets of 10 to 15 reps, and you're going to lie on your back. You're going to clasp your hands behind your knee, and you're going to flex your ankle up towards the ceiling. Now, if this is too hard for you to hold the back of the leg, you can use a towel or a yoga strap. And I'm going to get you to extend your leg up towards the ceiling. You're going to keep that ankle flexed down so your toes towards your nose. Hold for 5 seconds, slowly come back down. You should feel a gentle stretch. It should not be painful. You should be able to feel a stretch through the calf here as well as your hamstring. and coming back down, and we perform 2 to 3 sets of 10 to 15 reps. And the third exercise we're gonna do to help reduce your swelling in your knee is quad setting. So this exercise is actually to help activate and strengthen the front of the knee, but we're also looking at it as almost like a pumping mechanism to assist the inflammation. And so you're gonna need a foam roller for this, or if you don't have a foam roller, you can just use a couple pillows underneath your knee. You're going to extend your legs, slide the foam roller underneath behind the back of the leg, hands behind you to support you. And what you wanna do is just lightly extend the leg up just before the point of pain. So if you can't fully get to end range, maybe this is your end range or just before you start to feel discomfort, hold that. You're gonna hold that for 5 seconds and then slowly come back down. So why I love this exercise for knee inflammation is, one, you're helping to reduce the inflammation out of the knee joint by elevating the leg, but we also wanna make sure that you do not lose muscle strength due to the atrophy that the inflammation creates within the knee joint. So this is a great exercise that you can do at home, and you do 2 to 3 sets of 10 to 15 repetitions. Don't forget to hold for 5 seconds at the top. So you really want to make sure that you can feel that contraction here. Once this exercise starts to get a little bit easier, you're noticing the inflammation's coming down, you can actually do this with a band wrapped around your ankles for resistance, or you can even progress to doing banded leg presses. So there's a lot of progressions from this point, but essentially these 3 exercises that I showed you today are going to be the most helpful to reduce the inflammation and help you improve your mobility. Now, the rule of thumb when it comes to exercises and stretches, when you're dealing with an injury, you need to follow these key points I'm about to share. To keep it simple, for all the stretches, hold them for 3 sets of 30 seconds. And for the strengthening exercises, you'll do 2 to 3 sets of 10 to 15 reps. Now, if you have pain with any of these exercises, stop. Don't push through them. But if your pain is low and it does not increase while doing these exercises or after, then I encourage you to keep going and see how your knee progresses. If you notice an increase in swelling, then maybe try doing less repetitions, or if you've progressed to strength exercises, then maybe it's too soon to jump to those progressions. In between each exercise, take 30 seconds to a minute break just to let your body recover. And for the stretches and mobility exercises, you can do these daily, even a few times a day. And the strength exercises, I suggest you doing these every other day. You should start to see progressions within a couple of weeks. And if you're not seeing progressions, then it's always a good idea to see your healthcare professional for an assessment to make sure that nothing else is going on. So the do's and the don'ts. You want to unload the joint, so rest, or as I usually suggest, is just decreasing the load on your knee joint to allow your knee to recover. You can also use compression and elevation to facilitate the swelling, just as I showed you in these exercises. And for cardiovascular fitness, I suggest swimming is one of the best activities you can do early on to reduce the load on your knee joint. And once you start to see more of the swelling come down, you might be able to try using a stationary bike. Then you can put it on a low gear and just have your legs spin just to facilitate that reduction in inflammation. So now for the don'ts. I suggest that you avoid ice, and here's why. Published by the British Journal of Sports Medicine in 2020. Despite widespread use among clinicians and the population, there is no high-quality evidence on the efficiency of ice for treating soft tissue injuries. Even if mostly analgesic, ice could potentially disrupt inflammation, angiogenesis, and revascularization. So essentially, stick with rest, compress, and elevate. Definitely don't run, stand for a long period of time, or walk if you have significant swelling or pain. You want to reduce the inflammation, so it's better to have the leg elevated and find lower impact activities that you can do to start with. One of the biggest reasons why to pay attention to swelling and reduce it is because it causes atrophy of the tissue, and that makes you more vulnerable to decreased strength and stability. If you feel like your knee is going to give out on you, this could actually be a result of the wasting of the muscle tissue caused by that swelling. So this is why we need to stop the swelling and get you more mobile. So just remember, there's always a way to stay functional and continue progressing even when you're dealing with an injury, pain, or setback. If you have any questions, leave them in the comments below and I'll get back to you. I hope you now have a clear understanding of how to improve your knee swelling and manage your pain effectively. Don't forget to subscribe to this channel for more tips on injury prevention and recovery solutions. Thank you for watching, and I look forward to seeing you in the next video.